I believe that Jen is in DC as well. She's our Minnesota partner. We'll miss her awesome input, but yeah, that we're gonna take the reins today. We have an amazing presentation from Julie today. I'm gonna let her introduce herself, but I just think this is a presentation that not only will help DSPs, but the managers, just anyone. It looks like a great training. So I will stop sharing my screen and let her take over.
And can you see my screen there? Wonderful. Okay, well, thank you so much for inviting me to share today. We're going to talk a little bit about thriving through the holidays. And like Jessica said, this is for everyone at any time, because we just don't take care of ourselves. So this is for you, for your clients. And this is not just for the holidays, this is for always. We have to do this all the time. So a little bit about myself. So I am Julie Landsiedel. I'm a family nurse practitioner here in Bismarck, North Dakota. And I have been educating on health and what health now about 7 years, and living more of a health lifestyle since about 2010. So I'm a family nurse practitioner here in Bismarck. Most of my career prior to being in private practice was at St. Alexis. I was an emergency medicine nurse practitioner for 10 years, worked in intensive care. And really what had happened was I had some health challenges of my own. And in our, prescriptive medical world, no one ever taught me to change how I eat. No one ever taught about inflammation being an issue, about, there may be other options that we can do at home for ourselves to improve our health, empowering our health. And so I kind of was encountered with some wellness options, and it drastically changed my health at that time. Moving forward, I stepped away from emergency medicine and work now on empowering people to conquer their health. So that's what I do, and I could rant on health forever. My husband Dave and I celebrated 25 years of marriage this year. We have 3 kids, Jordan, Landon, and Triton, and my 2 boys are both nurses. So I'm super excited to pass on the nursing reins to them. And I have a son-in-law, Tyler. I'm a certified low glycemic lifestyle coach. So sounds so simple, but I help teach people to eat healthy and to keep inflammation and blood sugar stable in their body. I'm a certified Les Mills body pump instructor. So I do teach body pump here in Bismarck 2 to 3 days a week. I was in the military and super proud to be a veteran. I've graduated from University of Mary a couple times, and I always say I should own a building out there, literally, for as much as I've gone to school out there. And so thank you everybody again for inviting me and for joining in today. I just want to share a little bit about some of the services that I offer at Step Wellness. At the end, I do offer free wellness consults, because many people in the world don't even know what wellness really is. And so I do free consults, and I'll give you that information at the end of how to schedule one if you so choose. But I do a lot of corporate wellness education, custom health, whether people are looking to step away from prescriptions or just manage the side effects of prescriptions. That's actually probably what I do a lot of, because prescriptions do deplete nutrients. So that's a big thing that I work on. I do a lot of weight loss and lifestyle management. Sports physicals. I love educating and spending time with our youth. It's fabulous. The testing that I do vitamin D testing, food sensitivity testing, and then again, custom supplementation. And then I do some non-invasive microneedling, collagen induction therapy, because I have a lot of people who come to me for more natural things, and so I do offer that as well. So that's a big thing over the winter time. So let's talk a little bit about what we think the holidays should be. And like I said, it's not just for the holidays, but this is what we see watching. I just said to my husband last night, I'm like, oh my God, there's all these Lifetime movies of Christmas on already. I'm just not ready, even though we got 25 inches of snow in Bismarck, but I'm just not ready for that. And this is what we think the holiday is supposed to be like. And this is the reality of what it really is. It's not that pretty little picture. We're walking down the street, drinking hot cocoa, et cetera, et cetera. And so this is what we see on a general basis. There's the shopping, there's the snow, which came a little bit sooner, I feel, for us than we wanted. Kids crying, going shopping, a little bit holiday excess, whether it be drinking, whether it be eating, all of that through the holidays. Bills, going shopping, the expectation that we're supposed to be spending all this money, and then we get into January and we can't survive, and we add all these things into our plate for stress, and whether it be that we choose to or whether we feel the pressure from people around. Again, eating, watching Elf is always a good stress reliever. Eating like Elf probably is not going to be a good stress reliever. And then at the end in January, this is what happens. And it's people come to me and it's like, help me. For all the reasons we just discussed, is help me. And I just feel like we should take the time to survive the holidays and more thrive the holidays versus putting our body in this cycle every year that we just wreak havoc on our health, November and December, and then we're trying to, paddle upstream again to recover from it. This is kind of the holidays in a nutshell. Christmas shopping update. I bought myself something from my husband. I bought my husband something from me. I bought my in-laws something from us. I bought the kids something for my husband, and I bought my husband something from the kids. Any questions? And then I always laugh, about 6 months later, I find one of the gifts in the closet that I hid there that I forgot I even put there. I'm sure I'm not the only one who has ever done that. I'm like, oh my God, seriously, people. And so this is what we end up happening. So causes of stress during the holiday season. It's for many reasons. One is we're spending don't even have, we're maxing out credit cards for things. And really, I think our kids are looking for our time more than a gift. And again, I don't know if it's the pressures from outside or what, if it's internal, but we spend too much money. We put too much in already busy days. I'm thinking you guys are all really busy this week, because if anybody is, I'm not sure what part of the state everybody is, but we are 10 steps behind with the blizzard this week because we were closed for 2 days in the clinic. So all of this is happening, and we put unrealistic expectations on ourselves, our guests, everything happening. Traffic's longer, we're shopping, stores are congested. I know we've moved to online shopping, but we're back out in the season and driving around, and people are everywhere. Family conflict's a real thing. I mean, for people to ignore or pretend that all family dynamics are perfect would be an unrealistic expectation. And that does cause stress in families. So all of this added together with the rush, and then adding in unhealthy foods, things like that, not time to exercise, our stress level takes off. And then we end up not sleeping well, and all the how does stress negatively impact us? Now, I want to just one step back. Is stress, some stress is okay. And short-term stress can give us energy to be very productive. I mean, we can get new projects done. We can, all these different things that can happen. It can be motivating. But our world has been in chronic stress for almost 3 years now, 2.5 years. So we are already heading into the stress of the holidays behind the game. I'm just going to say, because I see it every day, the chronic effects of long-term stress. We are not meant to be in that stress. So we're already in a deficit before we move into the holiday season. So some of the signs of stress is just being crabby, feeling irritable, feeling just mad, mood swings. I see a lot of people with physical pain complaints, whether it be headaches, your stomach ache, belly ache, constipation, back pain, just overall not feeling good. People stressing about the future, anxiety, sadness, just people feeling sad. And it's a real thing during the holidays, and not just the holidays, loss from suicide. And I empathize, and heart goes out to anybody dealing with this, because these are real topics that I know people are dealing with, because sadness can be overwhelming during the holidays. Loss of appetite, or maybe eating too much. depression, sleep problems are very huge. I see this all the time. Concentrating, fatigue, and literally just feeling overwhelmed. Just can't stop, make it through the day feeling very overwhelmed. So what are ways not to manage holiday stress? Well, some of our stress affects your health on its own, but it can also lead to unhealthy behaviors. And that's where I say stress can lead us to eating more, drinking more, use of drugs or alcohol, smoking, and just having harmful coping mechanisms, because we don't really address the issue. And we really have to look at how can we empower our health and not burden it more with unhealthy mechanisms. Don't shoulder the burden of stress on your own. Talk to loved ones and people that you trust about what's on your mind. So if you are someone who is, I'm a big advocate of counseling. I'm just going to say, but I also do understand that those of us in the healthcare or the direct care world, first responder world, we find it hard to find someone to talk to in counseling because we know everybody. So if you are looking for someone for counseling outside of your local area, send me a message and I'll have my information at the end, because I do know what it's like being a health provider or a direct provider and needing someone to talk to, but you know everybody in your field. And don't ignore stress. Manage the stress is going to make the holidays much more manageable and make the new year much better moving forward. So holiday gifts. I'm not going to read this off here. You can definitely screenshot this. But the thing is, though, I think we really need to look at, how much money do we spend during the holidays? I will think that our kids, and I'll speak for myself, my kids don't necessarily talk about the gift we gave them one time, but the time we spent, maybe when, whether it's an activity together, whether it was a vacation together. But don't put yourself into financial hardship, because that does affect the whole family. And then also moving into the new year, we just start the new year with just difficulty going from there. So look at it as a gift that's more thoughtful, kind, loving, handmade, time spent together, things like that. And so I know there's a lot of shiny things out in the world, but I don't want our families to head into the new year also suffering. And we do, it's kind of like this wheel that we run every year, and we do it every year. And it's time to kind of just stop, because I don't want anybody being on financial stress because of the holidays. I added this in because this was actually a comment from someone else that they get so stressed out about the holiday Christmas cards every year. And I will admit, I'm one of them. I'm like the Christmas card freak, but it gets to the point where, one, can you afford it? And one, do you have time for it? Don't do things that stress you out. So I just say, if you're thinking that I can't afford holiday Christmas cards, or it's too stressful to try and do it, maybe this year, just send text messages, make a post on Facebook, things like that. Take the time and step back. I give you the permission not to stress about the holiday Christmas card. That's my tip. That's my family down there, the typical Christmas card that just doesn't quite work. That's actually a couple of years ago. They're much more grown than that. But just knowing it is okay to stop doing the things that cause increased stress on you during the holidays. That's just a thing. What I want you to focus on is, what can you control? That's what, because and this is for the last couple of years, and this is for really life always, but I think we've just become more aware of it, that let's focus on what we can control, because there's a lot of things that we necessarily can't control. So how do you eat? How do you move? How do you hydrate? How do you supplement? How do you feel? What do you think about? How you sleep? These all matter. All these things make a difference in what we're going to do. And I'm going to give you some tips on how can you maximize and implement these for yourself, and things that you can also share with your clients. I always say you will never be wrong by being an advocate for health in your family. I don't care. I know our kids may not always like when we implement health in our household, but they will thank you later, because I've had this happen with my own children. You are never going to be wrong as a parent, a spouse, a coworker advocating for health for people. Number one is we have to eat better, and it's not eating less. It's just eating better and actually really eating. Most people in the world do not eat enough. In my office, I rarely see people eat are eating way too much food. We might be eating a lot and not the right things at one sitting, but overall we are not eating enough. So we need to eat more frequently and eat smarter. Every time you're eating, I want you to remember this: protein and fiber at every meal. Protein and fiber at every meal makes burning fat no big deal. So because fiber is the #1 thing to help bring down the glycemic impact on foods, that means what foods are impacting your blood sugar. So here's some of the tips that are, I'm going to circle some of the ones, but they're all important. But one is, over the holidays, set realistic goals. This might not be the time to go on I'm going to lose 50 pounds, or I'm going to things like that. The #1 challenge that I actually do over the holidays, and I'll share the class I'm currently running, it's a 0 pounds challenge, because the average American gains 7 to 10 pounds over the holidays. And so if you can just maintain, you are ahead of the rest of the world. When you're out, bring friendly snacks. So finding recipes that are healthier options for you. The big dreaded avoid snacks in the break room at work. Oh, I so remember that at the hospital. People want to share food with people over the holidays. It's our way of showing we love them, that we like them, that we care about them, that we appreciate them. But the thing is, we should, one, go back to #5, is bring healthier snacks for ourselves and for people around us. If you're going to holiday parties, go full. Because I know how it is. So you're having a holiday party at 5 o'clock, and what we do is we don't eat the whole day, so we can save up our calories at the party. What you are doing by that is you are putting your body in starvation mode. And so when you get there, no matter what you eat, is going to be stored as body fat. We want to eat every 3 to 4 hours to keep our metabolism running. And I used to do this too. I was the queen of eating once a day in the emergency room back in the day. And it's amazing what happened when I started to eat every 3 to 4 hours. It very much changed my health, my weight, and my physical health as well. So make sure you're eating every 3 to 4 hours throughout the holidays. And always avoid drinks that are mixed with sodas and juices. Alcohol is not going to be the best thing. But mixing things with water if you are choosing to have alcoholic drinks. And always, again, make sure you're eating when you're drinking alcohol. Everywhere you go, bring a healthy dish with you. One of my classes this week, that's our whole topic tonight, is healthy dishes to bring to Thanksgiving next week. So we talk about that. Make sure you're getting sleep. You have to get sleep. Everything in the world is worse when you don't get enough sleep. Eat the cake that someone brings for you, or the monster cookies that are homemade. Absolutely do that. What I don't want you to do is, at the end of the day, you get where I don't even know what I ate today, but I'm bloated, I'm full, and I'm actually still hungry, but I'm having a sugar headache. So it's making a conscious eating through the day, not just haphazardly eating. I want you to decide what you're going to eat and make that choice to do that. Don't skip meals. As I said, don't skip meals. Keep exercising. We want to keep moving. Drink lots of water all the time, or if you're going to be having some cocktails, remember to say positive affirmations. And this could be printing things out on your mirror, or literally, we call it the power pose, or superwoman pose, standing in front of the mirror with your hands on your hips and looking at the mirror and say, "You are awesome. I am proud of you." Just remembering that you are worth everything you're doing, and just keeping the main thing, the holidays. Focus on you and your family. Don't forget about you. So this is just a class that I'm currently running, and the whole thing is to survive the holidays. That's the whole thing. That having no weight gain during the holidays, recipes, educating on low glycemic eating, keeping the blood sugar stable. We are already started. However, if anyone is interested in joining, you can send me a message. We just had someone join this week. Everybody's in a kind of a cleanse week. They'll be all ready for the holiday next weekend. And I do run these frequently. This is a 5-week class because there are people who want accountability and just to feel better during the holidays. And so I love educating on that. What I do during that class, and again, this is what I do in my practice. There's a list of foods, power foods to keep on track. Make sure, again, this is for everybody. eating vegetables, eating good fats, eating proteins. Again, remember, protein and fiber at every meal. Again, you can screenshot this on the right-hand side. It'll tell you, breakfast, snack, lunch, snack, dinner. You have to eat that many times. Please do. That keeps the fire burning in your body and the metabolism, and you will be farther ahead, even if you make some dessert choices over the holiday, which is okay, but we want to keep the fire burning in our body by feeding it. Number 2, exercise. I'm addicted. I'm just telling you, exercise of any kind helps boost and support the immune system and is a great tool for managing anxiety and stress. I know we've all heard this a million times, but I'm going to tell you guys, it is so true. I cannot advocate for this enough. I'm my own best example. I tell you, I think I would have lost it the last couple of years, like the rest of us, if I did not have exercise. Even when I'm preparing for traveling or speaking somewhere at a seminar, I will do an extra workout at the gym, leave my computer, go to the gym. Doesn't mean you have to join a gym. That's not what I'm saying. What I'm saying is just move. And I truly believe food is the most abused anxiety drug, and exercise is the most underutilized antidepressant. Again, get a group of friends. I don't care if you're planking in your living room, if you're doing some push-ups on your knees, do something. It is so helpful for our mental health on top of our physical health. It is great for our physical health as well, but it is so helpful for our mental health. So if you can just make the goal of, exercising 3 days a week, whatever that may be, it's going to help you so much through the holidays and beyond by just moving. So what are the benefits? One is it maintains your muscle mass. We want to maintain our muscle mass, and that's what I do in my low glycemic lifestyle classes. We want to lose body fat in inches, but we want to retain our muscle. And a lot of times when people are quote unquote dieting or starving themselves or eating once a day, you are losing your muscle mass. I want all of us to be able to get off the toilet at age 99 by ourselves. That is the goal. We need that muscle mass. The number one reason people go from either their home or assisted living to a nursing home is because they cannot toilet themselves. That is the number one reason that people have to go when I've talked with different nursing homes and with assisted care. So we want to keep that muscle. Exercise helps our overall cardiovascular, our immune health, our lymphatic system. I highlighted, if you can see it, it reduces stress. It helps burn fat, increases our energy, posture, anti-aging, all of the things. We're sitting at computers more frequently. We just need to move. Different kinds of exercise, cardiovascular and aerobic, any kind of movement like that. Don't forget weight resistant training. That is actually, in my mind, more important than cardiovascular. They're both important, but we want to do that weight and resistance training to keep that lean muscle is what we want to do. And then stretching, things such as yoga, like that. So doing all of these, but the thing is, what I have to say is any form of exercise is good. Most people are not getting any. So step one of just doing something is going to be the best. Start wherever you're at. It doesn't mean running to a body pump class that I teach, even though I would love to teach you. So anyway, if anybody's in the local area in Bismarck, if you would like to join me for a free body pump class, just at the end, send me a message and I would love to have you join me as my guest. I love educating on fitness. But keep moving, find a buddy. And if you're just brand new, not knowing where to even turn, step into TLS as my website, and under the resources, there's a fitness tab, and there's some downloads of just 10-minute exercises at home. And they are actually kind of hard. They're like for just 10 minutes, but they really do work that core. So that's something you can do as well. So repeat. And I would just say, there is no supplement that is ever going to replace your diet, your sleep, exercise, all that. The thing is, though, foods in general do not have as much nutrition as they used to. And that's a whole nother seminar I could do for an hour. That, when they used to say an apple a day keeps the doctor away, that was in 1970. In the year 2022, you'd need to eat 3 to 4 apples to have the same amount of nutrition in one apple back in the day. So all of that is happening. Also, we're not eating regularly. I wish we all would be, but we're not. And so, and actually based on, I didn't put that slide in here, but based on, I was going to say prescriptions that we take, whether it be prescriptions or over-the-counter medication, those deplete a lot of nutrients from our body as well. So if you're on an antidepressant, that depletes your B supplements. There's different things that deplete nutrients. If you're on a birth control pill, that depletes your B supplements. If you're on a beta blocker, if you're on a blood pressure medication, those deplete B supplements and magnesium. Ibuprofen depletes B supplements and magnesium. So we don't have to be even looking to, if you just start by where can I add nutrients in that are already being depleted by just everyday things that I do, again, that's a goal. So let's talk a little bit about stress and sleep. So individuals are feeling more stressed than ever. Lack of sleep is a big thing. Work pressures, social media, scrolling through Facebook. Oh my God, I think we should just all get off social media, except I know we need it for our businesses in our world. I know I always say if I didn't have a private practice or a business, I think I'd be off social media, but I understand it's part of our world has put us in this situation where we need to be on social media just to run a business, because that's just the way it is, and connect with people. And I do love seeing friends, but it is a stressful thing. Nearly 8 in 10 adults say that there is a significant source of stress in their life. 2 to 3 adults say they experience stress or it's increasing, it's not going away. And I agree with that. And my thought is this was probably written before the year 2020 hit. Nearly half of adults report that stress has impacted their health and relationships. And so these are some of the things that we talked about earlier. What affects your physical health or stress, physical complaints, crabbiness, mood swings, behavior, and lack of sleep. It's just from juggling too many things. And this is not even taking into consideration those who work shift work. I mean, I'm just right now referring to people who we just aren't getting enough sleep. Then you add in the shift work people, like my son Landon is an ICU nurse in Denver. He works shift work. I mean, he works all straight nights. And I'm like, oh child, I so remember those days when I worked night shift in the ICU and the ER. You were always sleep deprived. And it's so unhealthy for us. But I understand we can't all just quit our jobs. I mean, it's just not the way it is. Elevated stress or ongoing stress. And now when I say ongoing stress, I'm just not talking about the holidays right now. I'm talking about the freaking last 3 years. That has led us all to these lists right here. Stress-induced weight gain is a real thing. Kind of like they had the freshman 15, the 2020, whatever you want to call it. And the thing is, it's still happening because the stress really hasn't gone away. It does affect our immune health. It does affect our lean muscle. It affects our bones. I don't know if it's a coincidence, but I'm telling you, I've seen more people coming to me younger being diagnosed with osteopenia than I ever did prior to 2020. I don't know if it's because increased stress is causing some issues, but I'm definitely seeing a pattern of that. And just overall cognitive health is decreasing. So let's look at what nutrients, so again, eating better is going to be important. Exercise is going to be important. Stress reduction is going to be important. But what nutrients can we take that are depleted in our body that can also help with sleep? Number 1, B supplements. I cannot rant on B supplements enough because they are depleted by so many things. So like I told you, lots of prescription medications, over-the-counter medications, stress. If we breathe, we're depleted by B supplements. If we exercise, we're depleted by B supplements. If we drink alcohol, have any sugar, we drink coffee, stress and medications. Literally almost everything we do is depleted by B supplements. So using an activated B complex and not just an individual B, like I take B6, I take B12. I hear this all the time. They need to go together. B supplements have to work synergistically together, which is why you want to take a B complex because they don't work just individually. They're a unit together. We do not make B supplements, so we have to take them. They are not something that we make in our body. They're very crucial for metabolic functions. They're very crucial for stress, anxiety, helping with our sleep hormones, helping with our stress hormones. And again, they are water soluble, so we do have to replenish them every day. These are some of the things that they are beneficial for. And one is with your weight. because they help with the hormones that we're using. So we have to be able to have them, and they help with managing carbs in our system as well. Stress, and if anyone's, I get a lot of people are like, skin health is a big thing. Skin and hair health has become a hot topic the last couple of years. Again, whether, I don't know what the cause is, I'm not even going to go into that story. I just know it is. Biotin is a B supplement. So again, taking a B supplement, which therefore has biotin in, is very, very beneficial for you. So B supplements are very, very big. I want to, so then going to the next one, magnesium, and I'm telling you, I can't live without magnesium. Magnesium is so helpful for cognitive health, sleep quality, and just overall healthy habits. It's the fourth most abundant nutrient in our bodies, but most people have no idea what it is. And I will admit, I had no idea the importance of it until I took the time to educate myself beyond nurse practitioner prescribing world. This is not something this is beyond. So I do a lot of lifestyle medicine education. So it's a nutrient that helps relieve pain. So if you're someone who has migraines or headaches, you need magnesium. I had migraines for the first 40 some years of my life. I had no idea that magnesium is the #1 recommended supplement for migraines by neurologists, because I saw a lot of neurologists and I must have seen the wrong ones because they all wanted to do narcotics and prescriptions. I literally have almost no migraines anymore when I changed how I ate and I added in magnesium. It has been a life-changing. So if you struggle with migraine headaches, I feel your pain of missing things. And so that's something you can add in. It helps with sleep. It helps with mood, muscle tension. So if you have leg cramps have increased the last 2 years, 3 years. Again, stress depletes magnesium from our body. Taking this at bedtime, it helps with sleep as well, helps with stress. I have a nurse practitioner. She's a mental health nurse practitioner, colleague of mine. The first supplement she puts people on when they come in for stress or anxiety or any kind of like that, because she's a mental health nurse practitioner, is magnesium. That's her first course because we are also depleted. It also helps with diabetes. I mean, it helps with lowering risk of diabetes. Some common signs of magnesium. So if you have struggled with constipation, you need magnesium. I can't live without it. Muscle cramps, depression, fatigue, kidney stones, and abnormal heart function. Now, I knew about the abnormal heart function from the medical world. Magnesium is benefit, but so many people, it helps so many other things. And 60% of our adults in the US are deficient in magnesium. How it helps with sleep is that it helps with the synthesis of the neurotransmitters of serotonin and dopamine. It helps with the production of melatonin for the sleep-wake cycle. It helps promote GABA, which helps with relaxation of sleep, helps with mental health, emotional well-being, sleep and health, just overall. Again, this is one of my #1 supplements that I personally take myself and recommend for others. And so again, for all the things I said, if you're someone with sleep issues, migraine headaches, constipation, leg cramps, or you know anybody in those areas, this would be a good supplement to take. And if you're wondering along the way, how do I know what supplement to take? There's so many out there on the shelf when you go to the store. I feel your pain. I am, again, also the freaky label reader of supplements as well as for food. So I do have recommendations for all supplements that I use in my office, the reasons for better absorbability, because I'm also a true believer that we can take a lot of supplements and pills and different things in, but we can also poop a lot of them out. So the goal is what can you take that actually absorbs in your body? When you spend money on a supplement, you want it to work. You're not spending it to poop it out. So that's another big topic. So that's something you can definitely email me on. And then vitamin D. Literally, I could rant on this for days. And you've heard a lot about vitamin D the last couple of years. I've been ranting on vitamin D for years. All of a sudden, people started listening because it was on the news all over the place. It is so beneficial. The thing is, I prefer you get it from the sun. The reality is, I don't know if anybody has sun right now if you're looking out your window, because there's none in where I'm at in Bismarck. But the thing is, even when we are out in the sun, we put sunscreen on, I hope. And that prevents the absorption of it. We can get vitamin D from foods, eggs being one of the top ones. However, I also am the person who is the bearer of bad news when I do food sensitivity testing, because I can't tell you how many people are sensitive to eggs, and I'm one of them. Dairy, another big one, and we don't eat enough fish to get adequate vitamin D, because the biggest foods that I tell people to eliminate are eggs and dairy, also grains, when in food sensitivity tests. So personally for me, about 3 years ago, I had to take eggs out of my diet because I had high sensitivity in my food sensitivity test. And all of a sudden I started feeling more fatigued, and I couldn't understand why, because my vitamin D level has been good by what I ate and what I supplemented with. And when I retested it, it had dropped drastically, because I used to eat about 5 or 6 eggs a day. And then I stopped because I had to for my supplement with more vitamin D, because I had to take out those foods. So wondering, do you think our needs go up as we age? Absolutely. Less than 45% of adults older than 50 have adequate levels. I mean, we just do not have enough. I just tested some kids the other day in my clinic, an 11-year-old, he was in the 40s, that it's too low. And this is, I was seeing him for some mental health things. We have to get those levels up to help with depression, with the just mood. More than 1 billion people worldwide do not consume adequate amounts of vitamin D. More than 50% of postmenopausal women are low. And without vitamin D, we don't get enough absorption of calcium, because I always hear this, and I just had a lady in yesterday, osteopenic, again, it's so common right now, and they keep pushing the calcium, but no one's tested her vitamin D. And I'm like, how can you be on all this calcium, yet your provider will not test the vitamin D, and they want to go into shots now to help with osteopenia, but no one has checked your vitamin D, because without vitamin D, you're not getting the absorption of calcium. You see, these are hot topics for me. I get super excited because it just makes my head spin around. So I'm an advocate of getting your vitamin D tested. Let me go here. So vitamin D supplements, this is just for this is for everybody, but I do a lot with individual groups, Parkinson's, autoimmune disorder. And so there's been studies that show in the Parkinson's group, if their vitamin D levels are higher, they have less cognitive concerns or impairment and depressive issues. Our whole world deals with depression. This is not just for Parkinson's. So low vitamin D levels are directly linked to how our mood is, therefore depression as well. So I want your level to be optimally 60 to 80, even closer to 100. If you get tested at a provider, if they call you with your result, you have to say, what's my number? Don't let the nurse call you and say, oh, hey, Carol, your vitamin D level is good. We'll see you next year. 31 in our clinics, and that was me back in the day, is considered normal per the lab. That is only to prevent rickets. That is not for optimal wellness. So you need to say, but what's my number? And so you want to do that. And so I recommend 5,000 to 10,000 IUs per day, taking supplementation of that. If you're looking for some more things on stress, there's some adaptogens that are good. Ashwagandha would be my number one that I use in my clinic. There's lots of them, but ashwagandha is probably the biggest one. So just remember, there's a lot of things that we have to deal with. Take care of yourself. If you must spend the holiday alone, because it's a reality, the thing is, put up decorations, cook a meal, invite people over. If someone invites you, please go. There's a lot of things that are going on in the world that you can be out. Don't hibernate. Don't spend the time in isolation. Stress management, take a break. Exercise, including sex. Smile and laugh, meditate, learn to say no, eat well, take your vitamins, drink lots of water, and if you need, ask for help. I want you to ask for help if you not. Remember, laughter is the best medicine. And just a diet tip, if your pants won't get too tight, if you don't wear any. It's a real thing. It can happen in Zoom world. You can really do it, but hey, it's a real thing. So if you can do nothing else, get a good night's sleep. The quest for the perfect holiday is just a quest. If you want to reduce stress level during this time, strive not for perfection, but for peace, acceptance, and fun. Limit how much money you're spending. It's okay to make mistakes. Remember, take care of yourself. you can put your mask on first before you can take care of anyone else. Take that time for you. If there's anyone this weekend, I have looking for more education. On Saturday, I have a naturopath that I work with in Bismarck. If you would like to join me as my guest, let me know. I will provide your ticket because I love education. Dr. Deidre Mason is a wonderful naturopath physician who will be flying in tomorrow. She might be a little shocked by the winter that we are currently having. If anyone is looking to have a free consult with me, you can definitely email me. Just tell me you were on this call today, and I can send you a link to schedule a free consult via Zoom or in person. Thank you so much. So if you have any questions, I'll stay on the rest here for what other information you guys have.
That was wonderful, Julie. Thank you so much for all the information. I didn't want you to stop.
I know. I saw you pop on. I was like, I appreciate you coming in.
I didn't want to do it, but we do have some questions in the chat that popped up during. One was a question about apples being less nutritious. Can you elaborate on that?
Yes. Yeah. It's not that they just don't have as much nutrients in them because of all things that have nothing to do with us. So crop rotation, like how things are just grown these days. There's not enough nutrients in the soil as there used to be years ago. And so kind of coming from the farm, if everybody remembers CRP land back in the day, like I act like I know what I'm talking about, but I really don't. I'm just the kid of a farmer. But, rotating the crops, that has all changed. Also, they pick fruits and vegetables now before they're actually ripe, so they can ship them across the country. So it's pretty when it gets to you. And so there's just less nutrients in those foods, which really has nothing to do how you and I are. It's how things are grown. That's why I said I could do a whole nother seminar on the crops and the fertile soil these days.
Sure, that's interesting.
Mm-hmm.
There's another question. I know you said taking magnesium at bedtime. What about the vitamin B complex and other vitamins?
When to take them. So I see one here. So magnesium, I use one that has mag citrate and mag glycinate. Mag citrate is really good for constipation. I like a combo of them. So the one I use has mag citrate and mag glycinate. Mag citrate is what I would have given you in the ER if you came in with constipation back in the day. God help me. I'm redeeming myself from all the prescriptions I wrote to everybody back for narcotics and all the things I did. I apologize now. There's so many more options. But mag citrate and mag glycinate. So I use an isotonic formulation in magnesium. And so I have people use the magnesium at bedtime if they have issues sleeping or, anything like that. If not, they can take it morning time. B complex generally in the morning, but some people need it more than once a day. So goal is always one time in the morning, but I do have some where I have them take a second time early afternoon, depending on their fatigue level, their stress level, etc., like that.
Okay, sounds good. Any more questions that we have before we get to our case presentation?
Oh, somebody went to school with Triton. Hello. I was like, who? The school with Triton. Hey, Casey. He graduates in 4 weeks from today, 1 month from nursing school from NDSU, Casey. So Triton will be a little RN. That's kind of crazy. My baby graduates from college. Eek.
Well, I really appreciated the presentation. I liked your take on the holidays as well, and how there's this meme that goes around and it's like, here's me with my regular anxiety and here's me with my fancy holiday anxiety. And I relate to that so much. So this was really helpful. I'm going to pull up the case presentation. Julie, if you want to stay on for that.
Yeah, I will. Mm-hmm.
We're going to do it quick because we don't have a ton of time left. I'm not going to do breakout rooms, but we can communicate through chat, raising your hand, unmuting yourself. Any of that would work just fine. And hopefully I remember how to share my screen here. Okay. All right, so our case presentation, I need to stop recording for that. All right, so the background on this case, it looks like we've got a DSP who's newer. Just 2 years at the agency. They're a full-time employee. They have 3 children. Their spouse works at the same agency, but under a different program. So a coworker reported that this DSP seems to be really stressed out and has been really frazzled on the job. The coworker noticed that this DSP is no longer eating during their designated breaks. And when the coworker commented on it, the DSP said that they're trying to save money and mentioned their childcare bill coming up. And sounds like they were worried about how they were going to pay that. So the topics we want to look at discussing would be if this coworker has gone and reported this to the supervisor concerned about the DSP, is this the supervisor's role to address it? How can this concern be approached without overstepping or maybe embarrassing the DSP? And are there any resources in your community that could be shared with this staff member? If anybody wants to, you can chime in the chat or unmute yourself. I guess my first thought would be if I'm going to the supervisor and worried about the friend, is it more my role to address it with the coworker, or should it be coming from the supervisor? I'm not sure what you guys think about that.
I kind of agree with you. I was going to say the same thing. I know always going to the supervisor just makes it, I mean, none of us like to be called into the supervisor's office because then if it's already probably a difficult topic to happen. Yeah. And I guess if depending where they live at, I know in Bismarck, there's several agencies that have food, that you can get. I know there's a soup kitchen, there's different, things like that would be something to do, having a sit down conversation with them versus going to the supervisor, I guess, unless they've already had that conversation with them and it didn't. Yeah.
Yeah, I'm sort of feeling the same way. It sounds like maybe there's the real issue is food insecurity in the family. Okay, I see a chat here.
Yep. They just said that if the supervisor, if they don't know of a place, they could talk. You could always talk to the supervisor, yes, but whether the supervisor should address it or not, because they might have some place to, recommendations, right? Different people know different resources, so.
Yeah, but if anybody has resources to share, if you could pop them into the chat and we could include those. I have another comment here. It says, I agree. It should be someone who is closer to the person rather than the supervisor. I really agree with that. The supervisor could definitely give the friend recommendations, but this seems overreaching to address it. I agree with you, Roberta. I think it could be maybe the supervisor sort of modeling how the coworker can handle it and go back and hopefully providing some resources to help.
I agree, getting together where Christy said, maybe making a food basket, maybe getting some gift cards for restaurants or for the grocery store or something like that. And even, we've done it anonymously. I mean, sometimes people don't like to take things. I mean, I totally understand that they already feel bad. And so, I mean, we have done that, like where we've sent something, but it's anonymous. So they don't have to even relate that with feeling bad with someone they see the next time. So just making it anonymous, sending in the mail or in their work mailbox or something like that. That's something that would be a good idea to do. We've done.
Yeah, I love that idea. And then you don't have to respond and say thank you. You don't even have to, really acknowledge it if you don't want to, but you can accept it without, maybe feeling any type of embarrassment there. Any more thoughts on this? I was thinking about your presentation, Julie. It's hard when money's tight and the food that is going to make you feel better and is healthier is harder to obtain because it's more expensive. That's a struggle that.
And I do hear people say that, and I won't, I guess that's kind of like a whole nother presentation, but right. But I mean, we actually had it written out, like the cost of a bag of apples versus a bag of chips. And we had someone had a screen of that. I don't have it in front of me right now. And the reality is the apples were much cheaper, because like if for the same amount of price of apples versus chips, we could literally probably sit down and eat the bag of chips ourselves on the couch in one moment, where the apples you could have for days and feed more people, but we don't always crave apples. It's just, we don't crave broccoli when we're stressed. And so that's part of, and then again, that goes why we need to eat more frequently, because when our blood sugar is going down, or we're kind of going up and down. And like I said, I have so much more I could have shared with you in visuals on food, but eating more frequently then prevents us from craving things as much. But I truly don't think it's more expensive to eat healthier. And I'm not going to say, it has to be organic or any of that. That's even a whole nother discussion, because I know some of those are better, but that is more expensive. But really just apples versus a bag of Doritos, you kind of compare that, you can feed more and longer with a bag of apples.
That's true. Maybe I meant more convenience.
No, I know.
I know running around shift to shift and you're trying to meet, it's so easy just to pop through McDonald's, and so it takes a lot of planning ahead to be healthy, is what I've found. So
it does, right? It's right. Health is not going to fall in our lap. I mean, and we always say we're going to pay for our illness one way or another. We have to take, or pay for our health or our illness. We're either going to pay for it now by taking the time, or some dollars to make those choices and not go through McDonald's, but, maybe have food prep on Sundays. If not, though, you might pay for it at the end when you're either in the ER or diabetic treatment or whatever. You kind of have to look where to spend it. And that's why I would say we have to take the time for ourselves now. I see question, frozen vegetables versus fresh. Fresh is always going to be best. I mean, that's always going to be best. But again, if you look outside, we don't have fresh vegetables right now unless you froze yours from when you were, this summer. So frozen is going to be okay, but you have to read the label, go to the ingredients, and just make sure it's, whether it's carrots or whether it's peas, not peas, carrots, and sugar. So I'm a huge advocate of label reading. And actually, like tomorrow, we're doing it for the Parkinson's Association. We're teaching them to read labels for the holidays. It's like these simple little things. So just look at the ingredients and make sure it's only the veggies in there, not something else such as sugar added there.
And Casey, I didn't even see your comment. I kind of stole your scenario.
Oh, what did you?
Just bringing up how convenient the fast food can be and how maybe there's limited resources for the healthier food at times. But I mean, we could go on forever, but I need to be respectful of everyone's time. Thank you so much, Julie, for this presentation. I would love to pick your brain for 2 to 3 hours personally, but I can't. There is the survey link up that we will mail to you as well. But if you could take a survey on this session, we'd love to get your feedback. This is our last DSB session, our number 6. So I just want to say on behalf of our team, who unfortunately couldn't all be here, but we appreciate this so much. We hope that you've taken away some real resources, some real actions that can help you, improve your work life, your home life, everything. I know I have, so we really appreciate your time. That's probably what I want to say the most, is we know how valuable your time is. So the fact that you've given us these 6 hours has been great. We do have the DSP session coming up in January. Krista and we've been in talks about how to still involve leadership. We've just appreciated this so much, but we have to do it in a way where DSPs will feel comfortable and safe to express their concerns without fear of, repercussions or, people figuring out who they are. So we're trying to look into that. So we'll be in touch with you about that. But most of all, we just appreciate this, and we appreciate all the work you do. It's not an easy job, and I just commend you all for it. So I just want to say thank you, and we'll be in touch. And thank you again, Julie.
Absolutely. I wish everybody health and happiness this holiday season and moving into the year 23, which is insane.
Thank you so much. You guys have a great day.
Bye.
Bye.
Stay warm too.